So good evening, all of you. Welcome, Ravi, Kil, Anamika, all my dear students. Welcome in this session. I hope my audio video is fine. Please give me a quick thumbs up if my audio video is all fine. Welcome back in the next session of today's dermatology, and that is the INI-CET quick revision. We have a lot of image-based question today, and I would request all of you to please be live for next 30 minutes. It would be a 30-minute session, so not much. Only 30-minute sessions will be here. Very nice. So starting with a quick INI-CET revision of dermatology. Till the others join, let me introduce some of the new courses. Now on Unacademy, we have recently, or we have started today the batches like next batch for 2023 exam and NEET PG for 2022. It would be a 6-month batch, while the target next would be a 2-year batch. There is one more batch, and that is clinical case discussion. These 3 batches have started today. I request all of you to take Unacademy subscription. We have 2 types. One is Plus, which give you an access to live recorded sessions from the top educators. You have live quizzes, tests, access to around 25,000 questions, and you have printed notes if you take a subscription of 12 months or above. Now we have also one subscription which is known as Iconic, which give you an access to both Unacademy and Prep Ladder. In Prep Ladder, you have clinical integrated essentials, video lectures, question bank, rapid revision snapshots, treasure or dream notes. We have also updated our question bank with 25,000 plus questions, and now we have detailed explanation attached to it. On this month, we have 2 grand tests, one for FMG planned on 17th at 10 a.m. and another is for INI-CET planned on 17th, and the timing would be 2 p.m. I request all of you to please be a part of this test using the referral code CHESTA10. You have to enroll using a code, and please use this code to get yourself enrolled. Now, these are some of our amazing students who have performed very well in this NEET PG September 2021 and scored a very, very good rank or scores in the exam. I request all of you to also trust Unacademy like these people have done. You can take Unacademy subscription today. You can take Iconic, which has 1 year and longer subscription, and Plus, which has shorter subscriptions along with the longer subscriptions. I request you to take the subscription using a code, and that is CHESTA10. This will give you additional 10% discount. The most recommended would be 6 months for NEET PG or 1 year of Iconic for the next 2022 exam. So I request everybody to please be a part of Unacademy family and enjoy your preparation period with all the amazing educators here. We have all the top educators who have already achieved very well in their exams as well as in their careers. So I request you to please be a part of it. Now today we have a lot of image-based question, and it is a 30-minute session only. So I will be a little quick. Please give me a quick thumbs up if you are ready for the today's session. Starting with the first question. This was a recent exam question. Can you tell me in which exam you got this image? This was a recent image. Nothing was given, only one image. And here you can see the patient can extend the skin. Can you do it like this? Can anybody do it like this? No. You can never stretch your skin so much, okay? So this is because in this patient, you have deficiency of a very important component which provides resilience to the skin. It provides a proper resilience to the skin, which is missing here. Please remember, this is a classical case of Ehlers-Danlos syndrome, where you have collagen disorder. And in Ehlers-Danlos syndrome, you have abnormal resilience, and that is why patient can stretch the skin as much as possible. But in normal individual, that is not a case. Clear? So please have a look. The image-based question, you can get the direct image in your exam. Okay? Okay. Any confusion? Let's move to the next. A patient with skin tightening and cold sensitivity present with the following nail feature, what could be your diagnosis? Anybody can tell me the answer here. You can see the image, very, very classical of something. Amazing, amazing. So I'm happy that at least either of option 1 or option 4 is picked. It is okay, like majority of you are picking option number 4, but the correct answer is not option number 4. The correct answer is option number 1. What is pterygium? See, this is your nail. This is how you have your nail, okay? Now, what is this part? This is your proximal nail fold. And what is this part? This is your distal nail fold. When the proximal nail fold extend into the nail plate and fuse with nail bed, it is known as dorsal pterygium. It is known as dorsal pterygium. But when the distal nail fold extend onto the nail plate and fuse with the nail bed, this is known as ventral pterygium. And can you tell me whether you have distal part or the proximal part in this? Anyone? Please remember, this is the distal part. So this becomes a classical case of ventral pterygium. Is it painful? No, not much painful. No, it is not much painful. Okay. Clear, everyone? So please remember for this question, and remember that this type of ventral pterygium is a very classical feature of systemic sclerosis. And that is what is given in the question, that a patient has skin tightening, cold sensitivity. What will be the nail finding? The answer becomes option number 1. Take care. Chalo ji. Let's move to the next question. Again, a pure image based. I request all of you, if you find these questions interesting and if you want to join my course, please subscribe Unacademy today. These questions are previous year MCQs, so you have to be masters of PYQs. Try to memorize the images, try to remember these images along with the explanation part, whatever I am teaching you right now. Anyone can tell me the answer? I hope you all can see the poll. Is it visible, the poll? Yes. Okay. Okay. Very, very nice. Raj, Govardhama, Gaudama, Quartz, Shapnik, Kot, Kirti, Bachu, Dr. Chandra. See, only 38% students have answered this question. So remaining students, please start preparing. Dermatology is a very important subject. This year we had 13 questions in NEET PG out of 200 from dermatology. So like you can just compare the time to finish dermatology in comparison to other long subjects. They are very less, and obviously this is amazing if you get dermatology all the question correct. This is a case of onychocryptosis, also known as ingrown toenail, also known as ingrown toenail. Clear? Also known as ingrown toenail. Now what happens usually, if this is your nail plate, only this part of the nail, only this part of the nail has a capacity to grow. So nail will only grow in one direction. Nail will only grow in one direction. But what happens in a patient of ingrown toenail, you have little bit of extension of the matrix cells on the periphery. So now along with the vertical or the anterior growth, it will also grow below like this. It is also growing below. And that is what is known as onychocryptosis. Cryptosis means hidden. The nail is not growing like this. It is hiding below the nail plate. Clear? Please give me a thumbs up if you understood what is crypto means. Crypto means hidden. So the nail, instead of going straight, it is going little below. And that is known as onychocryptosis or ingrown toenail. Very, very important for your exam. How to treat this? You have to remove this extra part of the nail and you have to cauterize that extra matrix here. You have to cauterize that extra matrix so that new cell will not form. Okay, ji, badhiya. Now coming to another question. Now before that, I will show you an image of all these four nail changes. This is onychocryptosis. Have you seen a patient of onychogryphosis? This is onychogryphosis. You have a very thick nail which grows somewhat like this, like a tree. Okay, so this is known as onychogryphosis. Onychogryphosis. This is onycholysis, separation of the nail plate from the nail bed, and this is onychomycosis, that is fungal infection of the nail. Clear all of you with all these images? Raj, Panda, Z, Javed, Radio, RP. Everyone here, everyone will give me a quick thumbs up. Okay? Okay, Ji. Amazing. Chalo, let's move to the next question. Now, here you have a question and you have to tell me the answer. Pure image based question. Please tell me the answer of this question. Very well done. Now, please remember, you can see that there are multiple grouped erosions on the buttocks and on the knee. Along with that, they have given you that it is very, very itchy and it increases whenever the patient consumes wheat and oat. Please remember, wheat and oat is associated with gluten sensitive enteropathy, and this is a cutaneous manifestation which is known as dermatitis herpetiformis. This is known as dermatitis herpetiformis. Your teaching encourages us. Thank you, Shatnik. I request all the students and Shatnik as well. Please take a plus subscription. Trust me, you will start loving dermatology once you attend my plus course. Anyone who is attending my plus course or have attended my plus course, anyone here, can you raise your hand? Those who are attending or have attended. I hope whatever I'm saying is true because I have a lot of students who give me feedback that, ma'am, the classes were amazing. We started loving dermatology because of you. Those who are listening to this class, and if you feel that you are weak in dermatology and you still need a lot of revision, then please join my plus course. Take the subscription using the referral code Chesta10. You can take a shorter subscription of 3 months or 6 months, whatever you want. Okay, Ji? Okay. Now, Z is asking, ma'am, will onychomycosis always involve the whole nail? No, that is not true. It can involve only the part. I hope you remember there are different types of onychomycosis. Distal lateral onychomycosis, proximal onychomycosis, wide superficial onychomycosis. So depending upon the areas of involvement, you have different type of onychomycosis. So please give me a quick thumbs up if you understood this point. Very easy and very simple. Okay, ji, amazing, amazing. Now we have another question on the computer screen. Which allergen in this plant causes allergic contact dermatitis? First of all, tell me, what is this plant? Have you ever seen this plant anywhere near your house or fields or like, have you ever seen this image? Very nice. Ravi, G, Bachu, Goda, Dr. Priya, very well done. This is Congress grass. Yes, 12th class bio में दिखाया था. So this is a Congress grass, which is a very commonly used layman term, also known as Gajar grass. And scientific name is Scientific name is, what is the scientific name here? Parthenium. This is a Parthenium plant. Now, in Parthenium plant, there is an allergen which is known as sesquiterpene lactone, which causes allergic contact dermatitis to those who stay in close proximity to the wild grass, which is Congress grass. Always remember, like we suggest or we ask the patient to remove these, remove this plant from the surrounding area, either burn it or try to throw it somewhere else. And like if you have barren or open areas, try to grow some different crops so that there is no place for Congress grass to grow. So very, very important, and it causes a lot of allergy in the patients. Fine, chalo. So we are done with this. Another very interesting question. Nothing is given. Can you tell me what pattern is this? There's a cutaneous lesion. What pattern this could be? Okay, so I think I have marked, what did I mark in this question? I think I have marked this question option number one. Please remember the correct answer is option number three. So I think I've marked the poll wrong, and majority of you are right. The correct answer is Blaschkoid pattern. This is not dermatomal, this is not Langerhans line, and this is not linear. This is classical Blaschko's line, which are what? These are embryonic line or migrational line, embryonic line or migrational line, where the precursor cells migrate during embryogenesis. What is Langer lines? Langer lines are the lines corresponding, or they are in parallel to the collagen fibers. They are in parallel to the collagen fibers, which are Langer lines. What is dermatome? It is a part of the skin which has its own blood supply, its own nerve supply, and its own lymphatics. Okay? So you have difference in all three of them. Is it clear? Please give me a quick thumbs up, everyone, if this question is clear. Okay, ji? Okay, fine, very nice, amazing. Okay, this is a little tricky question. Can you tell me the answer here? They have shown you the image of axilla, and on the image, you can see a lot of small freckles on the axilla. The person with multiple skin lesions and a positive family history presented to us with this finding. What is the mode of inheritance? Okay, so a person with multiple skin lesions and positive family history presented with us with following feature. This is a classical case of neurofibromatosis type 1, and neurofibromatosis type 1 has autosomal dominant inheritance. I hope you all have understood this. I hope you have understood why this is the case. Here, because this is known as axillary freckling, which is pathognomic lesion, axillary freckling, which is the pathognomic lesion of neurofibromatosis type 1, and its mode of inheritance is autosomal dominant. Okay? Okay? Please remember all these examples because you do get a lot of questions from the mode of inheritance topic as well. In which of the following you see following nail finding? So this is an interesting question. In which condition you will find this nail finding? Psoriasis, lichen planus, chronic renal failure, or liver failure? Chronic renal failure or liver failure? In which condition you will find the following nail finding? Please remember, these are nail pit. Can you see some depressions on the nail? Yes or no? Can you see some depressions on the nail? So these depressions are actually irregular. So when do you call it as irregular and when do you call it as regular? Irregular means haphazardly arranged, and regular means if they are forming some pattern. I hope you understood the difference between the first image and the second image. First is irregular, which is classical of psoriasis. Second is regular, which is classical of anyone? Which is classical of what? Z, Anu, Ambuj, Raj, classical of alopecia areata. ठीक है? Alopecia, Darius कहाँ से आ गया? Darius में pit यहाँ पर होता है. Okay? So Anu, in Darius you have palmar pit. You don't have any pit on the nails. So there's a difference between the palmar pit and the nail pit. Okay? So the answer here is option number 1. Okay? Okay, ji, बढ़िया. Very well done. Very nice. Very nice. Let's move to another question which is given on your computer screen. Can you tell me what is the diagnosis? You can see that there's a lot of pigmentation on the face, on tongue, and even on the dorsal aspect of the hand. So what is this? Vitamin A deficiency, B3, B12, or vitamin C deficiency? Very nice. Sachi, Code, Valentinium, Venkatesh, Anupam. Mr. Cool, Anu, then Dr. Sana, Ambuj, Shatnik, Yogesh. Very well done, all my dear students, and I'm very happy that you all understood. Hyperpigmentation is the common side effect of vitamin B12 or folic acid deficiency. And here you can see that there's a lot of hyperpigmentation. Like whenever a patient comes to you with this type of black pigmentation of the skin, always suspect blackish pigmentation of the tongue, always suspect vitamin B12 deficiency. And you won't believe in India, there are many, many places where they consider that if you have blackish discoloration of the tongue, those people are considered to be cursed people. They have a very bad mouth. And you won't believe that I was actually practicing at a periphery few years back. And there was a mother-in-law who brought her daughter-in-law, and she told me that, ma'am, she is a devil for her daughter-in-law, that she is a devil, and because of her tongue, look at her tongue, she's having a black tongue, and whatever she says, it becomes true. So I told her that ask her to tell that you are very rich. Because if she's telling everything and if that is getting true, then ask her to tell something good, right? Why you are only thinking that whatever bad she is telling is becoming true? So please remember, it is not true that if you have black tongue, you are cursed, nothing like that. It is a normal condition. You should go for a vitamin B12 level, and definitely you will find it deficient. Okay? So being a doctor, try to educate the people around you if you are practicing at some peripheries or in villages. Okay, ji? So please remember, it could be genetic also, Raj. Maybe your friend is not totally wrong, but always first go for something like vitamin B12 levels, because see, if it is curable, why not to treat? So always go first for all these deficiencies, and if suppose if everything is fine, it can be because some congenital deficiencies, it could be because of that as well. Clear, all of you, with this particular question? Chalo. Another question is on your screen. I think this image is a little difficult for you to understand, but let's see how many of you can answer this. If you want, I can just zoom this image for you. Can you see some dot and round structures? Dot and round structures. Here also dot and round structures. So tell me, what is this? It's a little difficult image, and I'm very sorry that I could not bring a better image. But actually, you look or you get the patients with images like this. You never get very, very fancy images like what you have in your internet. So you in real you get images like that, and this is a case of erythema multiforme, and these are the target lesions. Okay, target lesions very difficult to appreciate or perceive in Indian skin. In the lighter skins, you can easily make out the three circles, the central dusky zone, the middle. Yes, this is my OPD patient only. So you have a central dusky zone, then you have a edema, and then you have erythema. So that is very difficult to see, but that is how you see regularly in your OPDs. And here in the question, they have given you that patient has taken a painkiller, which is the common cause for the erythema multiforme. Now, can you tell me which is more common, infection or drug for erythema multiforme? Which is more common, infection or drug? Amazing, amazing, amazing. Please remember, infection or drug, the commonest being, no, yes. So it is HSV, mycoplasma, which is the first, followed by drugs where you have sulfur group or painkillers. Sulfur group or painkillers. Okay? Shatnik, Dr. GK, Raj, Ambuj, please remember it is not drug. Infections are more common, and among the infection, it is the HPV which is more common, most common. Okay, ji, chalo. I hope this question is clear. Now we have another one on the screen. Can you tell me what is the drug of choice? I'll give you little history. This is a unilateral lesion, and you can see that there's a well-defined border. Can you see that this is normal, and here is the well-defined border? So what this could be? Yes, very nice. Whenever you have sharp demarcations, unilateral, asymmetrical, it is always tinea, dermatophyte. And for tinea, remember that drug of choice is terbinafine. For tinea, drug of choice is terbinafine. Can you tell me for which variant of tinea griseofulvin is drug of choice? फटाफट से आंसर दे दो. Very nice, Ballantidium. It is tinea capitis. For which type of tinea you use amorolfin more frequently? For which type of tinea you use amorolfin more frequently? I'm not saying drug of choice. I'm using the word more frequently. The answer is tinea unguam or onychomycosis. Now, which drug among these options is the drug of choice for pityriasis versicolor? Which drug among these four are the drug of choice or is the drug of choice for pityriasis versicolor? Please remember, pityriasis versicolor, which is a yeast infection, always choose azole group. समझ गए? Please give me a thumbs up if you understood. Pityriasis versicolor. And terbinafine is drug of choice for any sort of tinea. If nothing is given, please mark terbinafine as the best possible answer. ठीक है जी, समझ गए? Any confusion? हाँ जी, बहुत ही बढ़िया. Let's move to the next question. आ जाओ. Again, my OPD patient. Can you see this beautiful lesion which is present? Now I'm telling you a few more important points. Asymptomatic and a history of diabetes. Please tell me the answer. Gautam, Faiz, Ballantidium, Shatnik, Raj, Code, Sachi, Ambuj, PJ, Quartz, Plantaris, Jagdish, Ajay. Can you tell me the answer here? Now, please remember, this is looking like cutaneous larva migrans. How many of you agree with me? But if you look at very closely, you have one like this, you have another like this, if you can note down, and here also you have one. Okay? So this is not a case of cutaneous larva migrans because it is very, very itchy. Plus, there is no relation to diabetes. It can happen in anybody. So if it is having a relation with diabetes, it should be granuloma annulare, which is what? Which is a necrobiotic disorder. Necrobiotic disorder matlab you have collagen damage. You have collagen granulomas, collagenolisis, and collagen damage is seen in patients of diabetes and those who have increased sun exposure because sunlight and the acetylated glycated end products causes a damage to collagens. Okay? So necrobiotic disorder, the example is granuloma annulare. Understood? समझ गए? Any confusion? ठीक है जी. Can you tell me which will be considered as a first line treatment for this particular patient? Amazing, amazing, all of you. Raj, Aruna, Uma, Gautam, Goda, Quartz, Sachi, Faz. Very nice, all of you. Very nice. Please remember, this is a classical case of urticaria. And what are these? These are wheals. For urticaria, the treatment of choice is antihistaminic because the main mediator causing urticaria lesion is histamine. So you have to give antihistaminics to take care of the histamine which is released from the mast cell. So with this, we are done with the today's session. I hope you have enjoyed this brief session of 30 minutes with a lot of MCQs. I hope you like these classes. We will be taking these classes little more or little more frequent. I would request all of you to please subscribe Unacademy using the referral code Chesta10. It's a high time. Please don't waste time in thinking. If you're actually interested, do attend a plus course. There are all amazing doctors here on the platform trying their best, helping you understand their subject with details. Okay. Definitive treatment steroid? No, no. Ambuj, you never give steroids until unless you have respiratory compromise. If there's no respiratory compromise, even with generalized urticaria, you give antihistaminics only. ठीक है जी. Chalo ji. So bye bye. Take care. Good day. And please remember my code Chesta10. Bye.